a cervical check at your prenatal appointment starting at 36 weeks indulatory, and it is my experience that most people will be offered or given a cervical check at those appointments, usually by about 36 weeks and onward. What does it do? It satisfies curiosity. You know if you're dilating or not, if you're effacing or not. You get some information. What's frustrating or tricky, maybe I should say, about that information is it does not tell us when labor will start. And a lot of people will interpret it that way, including your care provider. I've had plenty of clients who are told like, oh, you're 2 and 80 and you're going to have a baby this week. And then they don't. And that week is a lot more stressful than if they had just kind of been waiting in the normal way. One is, yes, it can satisfy curiosity, but that can be a slippery slope. The downside of these, right, is they're uncomfortable. There's an opportunity for the care provider to actually impact the cervix, sweep the membranes, do a more aggressive exam to try to stimulate some labor without your permission. Unfortunately, that happens. So that's absolutely something to address prior to any cervical exam. There's opportunity for, cramping and response and a little bit of bleeding, and that can be really stressful, especially if it doesn't turn into labor and you spend the night cramping and being uncomfortable and get nowhere. Small risk for infection or breaking the water, and those are very obviously serious things too. More commonly, it's just something that gets done, and I think my question for the care provider would be, does it change your care? Are we going to do anything different? If it's closed, if it's open, does it change my care? And if it doesn't change the care, it'd be great to not be curious and just skip it. Obviously, do what you do. I just want you to have the information. Just know that a lot of times we get these cervical checks and they actually don't tell us anything other than that's where your cervix is or isn't doing right now.